Hi guys, my name is Talisha Brown, a peer facilitator from Pretoria Campus. We're here on a debate based on circumcision. On my left-hand side, I have my peer educators, and on my right-hand side, I have my debate team. So I'm gonna hand it over to Figile.
Hi everyone, my name is Figile. I am a peer educator, also secretary, deputy secretary. And today we're here to discuss voluntary medical male circumcision. So to break it down, voluntary meaning it's voluntary. You're not coerced, you're not forced. It's a personal choice. Medical, it is done in a medical facility where you have skilled professionals to do the procedure. Basically, it is a surgical procedure that involves the removal of the foreskin of the head of the penis. And basically what that essentially does in a nutshell is that it removes that breeding ground for pathogens, bacteria, viruses, for them to thrive. So it has a lot of benefits, not only for males, but also for females. So as I've said, that when the foreskin is removed, it removes that breeding ground for bacteria. It also helps with a reduced risk of STIs, including HIV, certain penile problems like difficulty in retracting the foreskin fully in order to expose the head of the penis. It also helps with certain penile cancers as well as hygiene. It makes it easier for a male to clean that area in order to prevent infections. It doesn't make you immune to STIs, but it lowers the risk of contracting STIs. Okay. Next speaker.
All right. Please switch it on for me. Switch it on. It's green now. All right. So thank you. Now, what we have heard, okay, circumcision has multiple benefits, but the main question we're asking as an opposition is it medically necessary? Is it a necessity? You can have something that's beneficial, but it's not necessary. Because the way circumcision is pushed, it's in the essence of it being a necessity. Everyone needs to get circumcised. So is it medically necessary? So as the opposition, we're saying, not for everyone. Not in every case that it actually has to be a necessity. And what we're gonna show you the correlation that whether or not you have circumcision or you don't have it, as much as they say it reduces the risk, pretty much a non-factor. So to get into it deeply, we have to consider also that it has risk. There's risk involved. So people have to be notified of the risk associated with circumcision. I mean, a person can bleed. During the process, you can get an infection. Such things that need to be catered for. That a person can actually get diseases from the same process that it's meant to actually benefit them. Another issue we have to look into here is pain. It's very painful. Yes, during the process, you have anesthesia there, you don't feel the pain. But during the whole healing process, it's very painful. The trauma that comes there. And we also have to consider the baseline of circumcision. Yes, today it's presented as a medical, operation. But where's the history of circumcision going from? Circumcision goes deeper into your ancient times whereby it was religious and cultural. So therefore, our standpoint is that it's more biased because of that. People are more immune to actually circumcise due to religion and culture as opposed to its medical benefit. So that is just what we're going to address all in all. So as I've covered, the first part is your risk. They are low, yes. The government side will tell you that there's low risk, but they are there. We cannot neglect them. We have to consider them, that as much as the risks are low, but they are there. There's a risk. Something can go wrong here. So it should not be put as a perfect procedure that everything is always going to be fine. So there's a lot of risk that are associated with bleeding or infections. The same infections that are trying to prevent, you can get them from the process itself. The second part, we talk about the pain. You go through a lot of pain because you are stitched up there. Every time you get an erection, it's worse. It's a job and a half. So that's the condition. We also have to consider that for the whole 6 weeks or your first 2, 3 to 4 weeks, you're going to be in a very painful and uncomfortable setup. Your walking can actually be affected as well. It's something to consider. But looking at the overall issue, is this medically necessary? Are we doing this because it's a medical necessity or because we're influenced by culture and religion? As she mentioned, it's voluntarily. Yes, that's how it's sold, but a lot of people are pressurized into actually going to circumcision. You find that right now I have a partner. If I have a partner and my partner wants a circumcised person and I'm not circumcised, doesn't that actually affect my decision? In essence, my partner wants this because in her understanding, I need to be circumcised for this to be more pleasurable. So therefore, even if I want to or don't want to, I will be circumcised. So we say it is influenced in essence. There's pressure coming from outside forces. So I thank you.
So I completely understand the need for the question of is it medically necessary. It is a very good point to bring up. But another point I also have to bring up is that although it reduces the risk for a lot of things, that being penile cancer, it also reduces the risk of cervical cancer in female partners. This has been studied not extensively, but in some randomized cases it has. Specifically randomized trials to see if the effectiveness is for a majority of a group or for a very specialized group. The foreskin, as said, can reduce the risk of HIV. This is due to the fact that the foreskin often suffers small tears during intercourse. This can allow the HIV virus cells to enter the bloodstream, along with the fact that it also contains immune system cells that the HIV virus can also attach to. This is a very important point to bring up because HIV virus is a very common virus, especially in South Africa and other places as well. And it is very important to know the risks that come with everything pertaining to your sexual health, your partner's sexual health, and your overall health as well. There are some risks, as you said, the healing period can be 6 weeks and it can be painful, as I've researched. But then in that case as well, you're doing it for your health, but you also have to do your own research. Because in some cases you said you can bleed. Yes, some people do have certain diseases, or it is a hereditary illness where you are more prone to bleeding because your blood does not clot. That is a leading factor that could steer you away from being circumcised because it could be a health risk to yourself. So in this case, although it is not medically necessary, it is a preventative measure to reduce the risk of contracting a lot of STIs and reducing your risk for penile cancer, and also, as mentioned before, the hygiene of yourself.
Okay, so hi everyone. I hear what you're saying in terms of preventing cancer and helping both the male and female party in sex when you circumcise. But I just want to ask you, is circumcision really helping the female party in terms of better sex, because as much as they're preventing or it's preventing cervical cancer, the foreskin is known for lubricating the penis, which helps a female party. Like you said, some people have hereditary diseases that they have, and some female parties can't like lubricate themselves, and this would actually prevent the partner, like the removal of the foreskin will prevent the partner from lubricating themselves as well, and like that wouldn't be helping anybody in terms of like circumcising. The foreskin has its functions, you know, so it has like the function of protecting the penis, it protects the glands that are there, and it also prevents the penis from friction, irritation and other stuff as well. It has the function of lubricating, as I said, because the foreskin has like natural lubricants that it provides the penis with, and this helps with more pleasure for both parties and makes sex easier for that. And then the penis also has immune system support, like you have mentioned, that you're saying that the HIV cells will attach to this immune system cells. But what I'm thinking is that, why are you saying that somebody has to circumcise in order to protect themselves from HIV when there are other effective ways to protect yourselves, like condomizing, taking ARVs, you know? Like, it's not really I wouldn't say it's not a good thing to say, but it's not a logical approach to say that you should circumcise to prevent HIV, because even when you are circumcised, you still have a high risk. You can just condomize, like that's what you should do, and then you mustn't, like, that will protect everyone, whether you have a foreskin or not, from getting HIV. So I don't think that point is valid as well. And then you also mentioned the thing about hygiene. Foreskin also helps with hygiene. I know many people don't know this, but that is a reason why men have foreskin and why there's even immune system cells in there, because it prevents you from like getting, like, how can I say it, infections from outside, like from your underwear and stuff like that. So you have to look at it as a thing of, why are you removing a body part that is already there to help you, you know? Maybe instead of circumcising, you should be pushing the notion of learn how to take care of that area properly, learn how to effectively clean, effectively protect yourself, and not just put the notion of circumcising is better because of this, that. Because really, if you look at it, that's just, it's not really true, because the foreskin also has these benefits. So it's actually neutralizing the thing of this is better than that, because the foreskin does have the functions that you have mentioned for circumcision. And why would you put somebody in a risky position, which is that circumcision operation, to like achieve these things which is already achievable with having foreskin, you know? Yeah, that's what I have to say.
Oh, okay. I can hear what you're saying. So, like, removing a foreskin, yeah, is advantageous in many ways, because there you get a long-term protection. I am not saying that you don't have to condomize. Yes, you have to use a condom even if you have circumcised, but that only part, long-term protection. So the other thing, when we look at genital hygiene, we get a simplified genital hygiene, which like help us in preventing HIV transmission and STIs. We can also look at some of the advantages, like increasing confidence. Yes, in our society, like, people can like have that pressure of, no, I didn't circumcise and stuff, but after getting that circumcision, you got that confidence, self-esteem. You are there in the public. Then we can also look at, for the culture. I heard my brother saying culture, religions and stuff. For the culture and social, nowadays most countries practice circumcision. And when we look at those cultural circumcisions, like initiation schools, nowadays they also provide doctors to check up on those people who are circumcising. So I don't think like culture can prevent like someone to circumcise. So we can also look at the reduce of healthcare cost. When you are not circumcised, that foreskin, inside that foreskin, it holds some of the bacteria. When you are not able able to clean, to practice how to clean it. So when I say like we reduce a healthcare cost, you won't have to like go to the doctors and stuff, or like you want to check for STIs, you wanna get ARVs. Sometimes when you go to some other doctors, they will tell you that they need a amount of money for you to be treated on a certain thing. But when you have circumcised, you have that advantage to reduce those costs. So when I look at to the positive aspects, quick recovery. I heard my brother saying that there's pain and stuff. There's a quick recovery from circumcision, which is 4 to 6 weeks. It's like my fellow peers said here, 6 weeks. Yes, there's pain, building, but if you practice all the positive aspects, you are going to be okay. So we also have this thing like circumcision is a part of a comprehensive HIV prevention, which is a huge part to be involved in circumcision.
So what the government has done, majority of this conversation and this dialogue that we've been having, is that the second speaker tried to downplay the downsides of circumcision. And with this is that when you're going to talk about and downplay the side effects and the risks that come with male circumcision, you must be mindful that when you're advocating for male circumcision that is voluntary, should you not be making tireless efforts to reduce the risk that lie and the risks and the death rates that come with the male circumcision. If you're going to talk about it and downplay it, then I would like to tell you that most people and majority of people that are yet to have or get their circumcision done is that they are scared of the stigma that comes with, or the risk factors that come with circumcision. They do not care, or they have little to no information about the risk factor. They have little to no information about what the hospitals are offering in terms of the post-surgery treatment. And also, when you come to an institution like the Tshwane University of Technology, instead of the health and wellness like you guys are representing, you guys would rather have the men's areas than have men conference that seek to advocate and teach and get and reach the young men and boys that are around campus that have little to no information about circumcision and are yet to do their circumcision. you care to do other activities, but you do not care to cater for the boy child. And it's easier for you to come here with us today and speak about it, but what exactly are you doing? Are you taking initiative to create and have community outreaches around campus? What have you done that we can say that the Directorate of Health and Wellness has gone to this extent to advocate and preach about male circumcision? These are the side effects, these are the aftermath of this surgery, and these are the benefits. Most people will not know because you are not taking enough action or are doing anything about it. But also, you also spoke about the societal standards. Who sets the standards? Who said that when a man is circumcised or not is less of a man? If a man is not circumcised, does that make him less of a man? You also spoke about it as if a person that is circumcised has it written on their forehead that they're circumcised, but it's something that is far. It's a genital that is covered by multiple layers of clothes. People will not care to know unless, of course, it's time to partake in sexual activities or intercourse. But also, I'd like to talk about, when you talk about the medical procedures and the costs that come with that. I think if we're going to be advocating, especially as the health and wellness, if you're going to be advocating for male circumcision, you must also be advocating for it to be accessible for every boy child or every young man that is yet to do it. But is it free? Is it something that someone can decide they want to do without having to think about the cost? With that, I'd also like to talk about how when someone is going to talk about voluntarily, you have to bear in mind that it is not voluntarily if there are health effects to it. It takes away and strips it from the word voluntary. So it does not become voluntary circumcision because you mentioned that there are side effects and it becomes breeding ground for diseases such as HIV and sexually transmitted diseases. So another thing is that we also have to talk about how if people like men have different immune systems, that not everybody has the same immune system, and that other bodies can fight off diseases and infections easily. But you do not care to talk about things like that, but you rather say that all men should get circumcised and it should be a standard procedure at an age where maybe they are consenting, of course. So with that being, I'd like to end my point today. Thank you.
Thank you. We're going to have a second round, so we're going to just change the speakers, and then we will touch deeper on this conversation about circumcision and voluntary male circumcision. I think there's aspects that have not been touched, such as cultural, traditional aspects. We haven't spoken about sensitivity. We haven't spoken about the benefit, the service, and how the health and awareness department will cater to those services. So we'll just take some time and then switch the panel.
Welcome back, family. We're going to dwell deeper on the circumcision topic. I will hand it over again to my peer educators, Figile.
To answer the question that one of your members had in terms of is it free? Yes, medical male circumcision is free. Yeah, and we offer transport. For example, if someone signs up with our institution, we offer transport to take them to the facilities where the procedure is going to be done. And even afterwards, we give them transport, even also for their follow-up visits. Ne? So in terms of the questions or the concerns that you had about risks, such as bleeding as well as infection, remember this is in a controlled setting where it's done by a skilled medical professional. So before anything, any procedure, you have your history done. So if you have a history of a clotting disease, they will know how to counter that, or they will exclude you, right? If you will bleed, I mean, it's a medical setting. They have ways in which they can stop that bleeding. Risks of infection. Remember, when you're discharged, they have prophylactic antibiotics that they're going to give you, a bit of painkillers that they're going to give you, if answering that question of pain. And I mean, if you look at it, what's 6 weeks in terms of like waiting that 6 weeks in order for you to heal, then having to come back to the hospital for recurrent infections, as my team member had already stated, that it increases the cost in terms of it's a load, the burden on our health system, because what we find is that males will come with STIs and that those could have been prevented. We're not saying that, like I mentioned, circumcision it makes you foolproof. It doesn't make you foolproof. And yes, we are saying that you can use circumcision and complement with condom use in order to prevent those STIs we were talking about. And then Javi also stated that is there a need for medical circumcision? The answer to that is circumcision is not a medical emergency. It's more of a preventative or precautionary measure for, as we stated, infections. Sorry. And then another member of yours also stated that the foreskin is also like an anatomical part that helps with the very same things that we're saying that if you remove it, it will improve. So as I've stated, that the foreskin creates like a barrier or a canopy where pathogens and germs can breed, right? And males don't really clean their glands. The glands is the head of the penis properly, retracted and clean it properly, right? So that's why sometimes you would come back to the clinic with recurrent infections. So it helps with that. It's more convenient. When it's not there, I mean, there's no breeding ground for these bacteria, right? And other pathogens.
Good day, everyone. My name is and I'm also part of Team Opposition. So I'm basically here to further elaborate and extend on the matters that were previously brought about by my fellow team.
Sorry, miss. Sorry. Just a bit now. You start again. My friend, you banging the mic and your phone, it's giving me static like that because it's very close to the microphone.
Sorry.
Yeah, so don't bang it and don't put it very close to your phone. Sorry about that, maybe we can start again.
Good day, everyone. My name is and I am from Team Opposition, and I'm here to further extend and elaborate on the matters brought about by my fellow team members. So my fellow team members brought a huge question mark that I feel like has not been answered throughout this discussion, which is necessity. The necessity of the reason as to why we should go for circumcision. Isn't there other ways that you guys have come up with that could prevent these sexually transmitted diseases, these cancers from erupting, while removing an anatomical body part of a human being? Does the bad outweigh the good, or does the good outweigh the bad? I feel like that's a question that I'm asking and I haven't gotten a response from. Another question that I had is the parameters that you're setting this discussion on. We live in a country where provincially there's not an equal distribution of health services across the country. I'm talking about a child who's in a village in Eastern Cape, or in a village in Limpopo, who does not maybe have access to Tshwane University of Technology and this information or these health care facilities. What about that boy? If it's a necessary medical procedure, why isn't it extended into all these outskirts and in all these villages where people don't also have this access to information as much? I also want to ask the question of, as you mentioned that there's not an equal distribution of health resources throughout the country, you mentioned the possibilities of there being ibuprofens and pills that help with the infection, but then not in all health facilities are these things going to be always there available. Or the extremes or the parameters at which, for example, if a child is taken in a particular village and then maybe the nearest clinic is about 20 km away, how convenient are you? How convenient is the message and the discussion on circumcision for someone who does not have these health facilities in their proximal distance? I also wanted to bring the question of separation or confusion or conflict that may arise with the result to you guys spreading the motion of circumcision. It disputes a lot of cultural practices, number one, where people who have a huge tradition, heritage, cultural beliefs, and a way of doing things. I fear that maybe the way that you guys are pushing the narrative of circumcision might be misinterpreted. We're living in a world, as you say, that is advancing, and we have ways in which we can tune these maybe initiation schools into medical procedures to help maybe lessen the chances of these infections or these side effects. However, there are some cultures or people that don't believe in these medical procedures and going to hospitals, they don't believe in doing that. So what do you say about those? Should they now end up then opting out for these traditional initiation schools that they've been used to, accustomed to, and the negative effects again that come with going there that we all know? So what do you have to say about that? So the question that I'm bringing is your parameters. What about those people who do not have access to these healthcare facilities? And another question again, which is the cultural dispute that it may bring about, because it's going to be going against some people's traditions, beliefs, and cultural practices. Thank you.
Hi everyone, my name is Pretoria Campus and I'm the peer educator for 2024. This first understanding of the circumcision thing, this started way back around 4,000 years back, and it was done by the ancient Egypt, and this was done for particularly different reasons. Some of them was to turn boys into men, letting them learn how to deal with pain and go into adulthood. And it was also done for the medical benefits, like they mentioned earlier. But I want to touch more on what my brother Alex had said about the risks and associated with this. There's risks, yes, of course, but you can prevent those risks. Like you said, pain. Pain is a catalyst towards you learning how to handle it and knowing that if I handle that, I can handle any obstacle coming in my way. And you also said erection can also cause some pain. I believe that the brain is the most important sexual organs. So if you feel like, okay, I'm having a morning mood, you can shift that focus very easily. And you know get an erection. You can control it, you can turn it on and off. And you also said about the risk of bleeding and stuff. All those things are caused by triggers, sexual triggers that can trigger you to be erected and end up hurting yourself. And also this, for infection, you can use antibiotics, brine, there's everything to help you like deal with those risks and infected with it. And also, it also helps with a lot of medical benefits, but your question was it really necessary? I wouldn't say it's necessary, and you said it could be peer pressure to do it. At the end of the day, if you want to do it, and like my sister said on the other side, this goes with many cultures and everything. So if your culture doesn't allow you to do it, we are not encouraging you to break your culture. We're just saying if you want to do it, you can do it. Because at the end of the day, I can't just explain to you that this thing is like this without you really wanting to do it. You gotta want to do it and experience it for yourself. And also, there's a lot of medical thing that may come with it, like medical risk also, like proper surgery happening and everything. but there's experienced people who knows how to deal with that. And my sister, about the people who are far away from these services and who are beginning to go to initiation school. My other colleague also said there's doctors nowadays in initiation school to make sure that those risks and infections are being dealt with accordingly. And those who are far away to getting those services, I believe now that free health services are available in every hospital. You can go there and communicate with the nurses and you can get necessary help. So, to answer your question, it is not necessary, but if you want to do it, why not? Thank you.
Thank you, previous speaker. You mentioned a lot of things, but mostly I believe that you're going around in circles. Our greatest concern here lies fundamentally in the alarming health and safety of these young men and boys that are partaking in this practice culturally and traditionally, and also the medical form of doing things. And also we would talk about the preservation and the need for cultural sensitivity in these practices. You mentioned that initiation schools now have doctors, but are those doctors qualified? Are they not bogus doctors like what Dr. Matthew? We're just speculating. I think if you're going to talk about doctors, I would have anticipated that you speak about how these doctors are acquired and how these doctors weigh. But I don't think these two things would coexist also, because this is traditional and medical. But to further continue with my point is that, yes, we do understand the health factors and the health benefits and the significance of having male circumcision done, but you must also consider the most vital point and the most important point of this conversation is human life. Is that while cultural male circumcision take away so many lives, also they do also have predicaments or ramifications if they are not conducted in a manner that is medically approved, like going to the mountains, is that most boys and men do not come back. If they do come back, they come back with more medical complications than they would have if they went to a hospital. Furthermore, cultural preservations are important, but we cannot measure them against a human life that cannot be renewed, restored, nor replaced. And I'm also saying that as you are sitting here with us and saying that these services are open to the public being our students in our institution, I want to ask, how far have you gone, to what lengths have you gone to educate the young boys and men around campus about circumcision, the benefits of it, rather than posting posters around campus? Have you had conferences, have you had gatherings about it? Have you gone to the male residences that are available on campus and off campus to talk about it, to teach them, and also let them know that these services are free at their disposal? I don't think you have done that. I'll also talk about the community outreaches that must be advanced and advocated for. Yes, you have peer educators, but I will tell you that I stay on campus, but how often would I see a peer educator on campus? It's very rare. And these are people that should be more visible than any other structures or any other directorate, because these are people that are talking about our health, and health is a great concern, especially to students' lives. We must also promote the knowledge of urology, because if you were to ask a boy child on campus, I can bet you this, about urology, they wouldn't know. Rather, they would be quick to answer about a gynae, because these are things that are not being taught or advocated enough for. And also, we are saying that, yes, we may say that male circumcision is a necessity. That's what you said, but we are saying, as the opposition, it must be a necessity, but it must not be practiced traditionally, because we want to preserve a boy life. And also, in my closing statements, I'd like to add that we can advocate effectively for the modernization and the medicalization of circumcision practices, but this also will be argued against cultural neglection. Like if we say that now we have doctors in mountains, medical doctors that are now being required to go and attend those things, initiations, for instances. Previously, those things were not happening. Previously, you would have a boy child that would go to the mountain and not have a medical doctor, a doctor that is qualified, not just a bogus doctor, a doctor that is qualified, run through their history. I don't think boys that go to initiation are set down prior to their initiation camp and asked about their health and well-being and the history of their medical history. Rather, you just get taken there, and whatever happens, it's literally up to the people that are conducting the camp. Let us also show respect for the cultural traditions while prioritizing the health and safety and the rights of our community members, which is particularly the young men and boys in this instance. Together, I think we can also create a future where our cultural practices are carried out with dignity and are catered for every individual that is involved. But also, I'd like to state that if we're going to continue as the health and wellness, and we are going to have such discussions, this is the start, a great start that we are heading to. This is a great start for people to know about the male circumcision. This is a great start for conversations that allow both genders to be here. It's a great start, and it's a great initiative that you've taken. But I'd like to ask you that from today, you have conversations as an organization or a directorate about how you are going to mitigate health issues that are involving the boy child and the young boys, men around campus. I'd like to ask you that, further going from this conversation, you have more activities on campus that promote circumcision, but also you must not neglect the cultural beliefs that people have. Thank you.
Good afternoon, everyone. I'm Cindy. I'm as previous states, male circumcision is a surgical procedure that involves the removal of the foreskin. According to my research, there are some medical reasons for a male to circumcise, where you find that the foreskin is too tight to pull back over the head of the penis, which can cause some pain if the penis is erecting, or you may find it difficult for the urine to pass through. So it is advisable to get circumcised because it is easier to clean the penis for hygiene purposes, because we know that if the penis is not clean, there are some dirty that are staying there. So it is easier for them to be transmitted to a female person and causes some cervical cancer.
All right. Calm down, guys. So, we've heard what you're saying, but we now give you a different view to look at it. We're saying the same process that you're bringing to say, to help can promote risky behavior. What do you have to say about that? Because now, due to the things you've mentioned to me, the benefits, I feel like I'm untouchable. I have a false sense of security. Which I've seen. There's multiple studies that have been done around it, that people who are circumcised are more likely to be in situations that are considered sexual risky behavior. Unprotected sex. They're like, no, I'm circumcised. I think there was also a stance on our former president, Jacob Zuma, in a court, where he was asked about diseases. Did you consider that? He was like, no, I'm circumcised. I took a shower after. We're done. Such things. So it promotes that false sense of security that I got this. So if I'm circumcised, I'm the man, I'm Iron Man, I'm protected. So what do we do around that? That's something that we need to touch as the health and wellness promoting circumcision. What about, it's in essence like a gateway to risky behavior. So we ask you that. Then we add an additional concept saying, what about sensitivity? The foreskin provides sensitivity. And due to its sensitivity, it's actually beneficial to the person. What about that? What are you going to account for that? What about someone who's worried that, what if I lose sensitivity? What if it's not as effective as I want it to be? What do you have to say about that? What's going to counter that? then we also raise another issue. What about the person who's not circumcised? What is there for them? I mean, everything I'm mentioning, your benefits, can be done without circumcision. You can get the same benefits from just good hygiene practices. Am I right? Think about it. The same process that we're fighting for here can actually be obtained through good hygiene practices. So shouldn't we actually speak about prioritizing education? Educate people about this. Good proper hygiene. Because as you're telling me, no, it makes it simpler to clean your area, but no one is talking about the actual process of cleaning the air. That would be more beneficial. Because now I know, oh no, okay, I'm circumcised, just pass through. You see those concepts. So we come to you and ask you that. What is done in terms of the education part? Yes, you come here, you explain the health benefits, we see that. We even ask you a fundamental question that remains unanswered. Is it necessary? Now we're adding to it to show you it's not really necessary in the essence of what? We can find the same benefits without this process. So why go through the pain? Why go through this whole shenanigans? Why? If I can get it from something else. That's what we're raising to you now. Counter that. You told us about how it's free and accessible. Yeah, it's free and accessible, but to what degree? You have areas that have only one clinic. Very far to them. Do you cater for them? You are telling us about an institution like TUT. Around TUT, there's so many government hospitals here. Whether TUT offers it or doesn't offer it, it's accessible to us. But what about the others? What about people outside, in the outskirts? Or is this only limited to our students? So let's talk about that. As much as it's free, my partner has mentioned, we have unequal distribution of health facilities. We don't have the same. You have people moving from Mpumalanga to get cancer. Chemotherapy, they get it here in Steve Biko. Just imagine. So if you tell me about this, are you sure that every hospital, every clinic in this country is equipped for this? Let's speak about that. Let's speak about the readiness. Yes, you like the concept, but is it ready? Is it fully functional? So we still come to you and say, our solution is that this is not necessary. We can find the same benefits without circumcising. And we always say, in this way, we actually cater for the person who's not circumcised. Educate them. We are promoting for education of the young boy. Educate the young boy about their own genitalia as you educate women about theirs. I mean, even myself as a male, I know more about female genitalia than mine. I've learned it so much. She even retaliated that. A large portion of my life sciences in high school was about it. When we went to human body, they told me about menstruation, the cycles, the what. I know more about them than they know about myself. You know their sensitive areas, the clip, the this, but do they know my sensitive areas? No one teaches that. We've mentioned multiple issues that people are actually coerced, as you've mentioned yourself. This started way before its medical benefit. Don't you think that there's bias now because of that? Let's think of a country whereby we are subscribing to Islam, or subscribing to a certain religion. Don't you think I'll be pressured to go there? As much as it's voluntary, but I'll be pressured. We'll give you an example, even in the traditional aspect, just to show you how people are pressured. If you go to Eastern Cape, if you are not from the mountain, you have your certain meat that you eat, you have your certain way that you must live. You don't need to ask. So don't you think I'll be pressured to go there? Not because I understand, I have an informed decision. No. Why should I eat the smaller parts of the chicken or the nice ones? Because So we talk about that, your culture, your religious bias. You've never attended to that. You still go back and tell us how health benefits, health benefits. Yes, but attend to the other issues. So many issues are associated with this. What's your view? What's your stance? How can we solve this? Is education part of it? So, there's a lot to say, but let me give you a chance.
Yeah, a mouthful was said, and we hear your guys' lament in terms of circumcision, us neglecting the cultural, traditional aspect of it. Look, there are, like as we've mentioned, we're not neglecting the cultural and the
tradition aspect of it. What we have, what the Health Department of Health actually has done is that they have sent out professionals to these initiation schools, right? They've sent them out in order for the procedure to be carried out safely and in a sterile situation, so that we do not have these deaths that are associated with it being done by the people that are there by the camps. In terms of proximity for children, people that are, or males that are in the outskirts, in the rural areas, in the rural areas, this is where initiation happens. And as the Department of Health, they go out to them and provide these services, right? And in terms of health and wellness, Directorate of Health and Wellness, yes, we do need to reach more people. We do not dispute that. We do need to reach more people, more males. We need to educate them, as you were saying, about neurology. Yes, it's true. We need to do more of that, and this is a starting point of that. So thank you very much for that. We definitely will take it into consideration. You've mentioned the issue of sensitivity. Sensitivity in a sense that during sexual intercourse it would be as pleasurable. We have things like lubrication that can help with the sensitivity of sexual intercourse, or making it more pleasurable. So lubes are actually also as available on the institution, at the institution, readily available as condoms. Right? You also mentioned the issue of bogus doctors. No, bogus doctors do not perform these procedures because we're working together with the Department of Health, and they get qualified professionals to come and do these procedures, right? Sure. Jabu mentioned a very, very, very important point that I almost missed. Giving you guys a false sense of security. Yeah, that one touched me. What we do is give information, right? And if you've noticed, is that we stress more on lessens the risk of, we're not saying you're immune now your health. No, you're not immune to these infections just because for the mere fact that you have circumcised. I hear the fact that it's being pushed in a way that it makes people think, okay, if I only get circumcised, then there's no use for me to use other protective mechanisms. No. Basically what we're saying is that we're laying it out there and saying, listen, these are the benefits. This is what it decreases. Don't say that it makes you immune. You're not immune to those things. And we do not disregard the fact that you should use them with other protective mechanisms like your condoms. In terms of the circumcision, free circumcision that we provide here at TUT, is that you come here to the clinic and you sign up to say you want to get circumcised, and then I think they give you a date, and then you will be fetched with a car that is not, it's not written anything. No one will know that this car is a VMMC car. It's not labeled, it's not, basically it's a private car. It's a private transport where it will take you guys there. So there's no need to worry about it being public knowledge that, oh my gosh, everyone can see that you guys are going to go get circumcised. Yeah.
So, So we heard a lot about circumcising. We heard a lot about male genitalia. We heard a lot about they are perceived caring, if I may say, in that way or say it in that way. But when we look into the definition or the abbreviation VMMC, meaning Voluntary Medical Male Circumcision, that's quite a mouthful, man. That's quite a mouthful. But as my brother here stated, the necessity. I heard you talking about lubrications not so while ago, and in your statement you clearly didn't necessarily emphasize condom use and other methods such as abstaining. Many studies show that VMMC lowers the chance to getting HIV or AIDS or any other diseases such as your herpes by 60%. Okay, condom use limits them by 90%, abstaining 100%. I didn't hear you talking about those two, but you just spoke on just that one aspect, which is circumcision. Is it okay? No, it's not okay. You have to stand on moral grounds, meaning you have to necessitate other aspects instead of circumcision, which I hear you emphasizing more during this discussion. So a study was done in Kenya in which male researchers found out that partial vaccines given to people, males in Kenyan hospitals, those males took further preventive or other preventive measures in order for them not to contract that disease that you said they shouldn't contract. So so you can clearly see the underlying tone here that the media, which you say is okay, is fairly in place. It gives information in a clear view to everyone to understand. That's not what's said in the media. Your campaigns clearly state that VMMC is appropriate. VMMC is the only drive way. VMMC circumcision is the only bygone or only bystand to increase the chances of not contracting HIV virus. So by that token, no, so no. And another thing, brother here talked about ancient Egypt, talked about the Egyptians, the pharaohs. Okay, so you talked about them going from male, from boyhood to manhood. Okay, that's a necessity. It's necessary for them to go from manhood, from boyhood to childhood, for them to circumcise, such as your Kenyans and also your Xhosa tribes. There's a necessity for you doing that. But is there any necessity for you in joining this VMMC as an African child, if I can put it in that context? Because I don't see you, when you join this program of the VMMC, as gaining anything of significant proportionality from anyone who didn't go from the VMMC. So yes, and please don't touch on lubrication, and I would advise that sister you don't touch on lubrication, because this is you should morally try to give light to preventing certain diseases. Because in your token or in your speech, you said that lubrication, it gives more pleasure. That would give someone who's listening to this discussion to think that, okay, now I just have to have sex with lubrication. You didn't touch on those crucial things that that deal with reducing that HIV virus or any other disease that is sexually transmitted between individual persons.
As you have heard, guys, we had a lot to cover, and I just believe that you should make an informed decision. Don't feel pressurized by any of us. I believe that we all have our own opinions. So thank you very much for tuning in to our session today. Hope to see you soon. Okay, please don't forget to like, comment, and hit the post notifications button so that you're notified every time we post. Also, don't forget to share our reels, our videos, and follow us on TikTok. Thank you.